As the coronavirus pandemic surged across the country, hospitals faced a crisis-level shortage of beds. The influx of infected patients forced overwhelmed hospitals to turn away transfer requests for patients who needed urgent care or incoming emergencies because of dangerously low bed availability. The global healthcare crisis heavily stressed hospital systems and the staff within them. As the world continues to adjust to the uncertainties associated with the pandemic, the last 2 years has highlighted the dire need to rebuild, restore, and recover. Thankfully, COVID-19 hospitalization numbers have plunged to their lowest levels since summer of 2020, which has given hospitals the opportunity to reorganize and reinvent hospital command centers and streamline patient flow management. So, how can we start? Current bed control management is a high-functioning operation. However, it is confined to command centers, telephones, and PCs across the hospital. In our current digitalized world, how can we do better? A mobile-based application is a reliable alternative solution that can complement existing bed management operations. The ward-based application is an overall visualization of beds. Additionally, the application can have mobile messaging capabilities between charge RNs and bed control staff for continuous communication and coordination. The application would be downloaded onto an iPad or iPhone that would be distributed to the unit's lead nurses. The interface would display bed information, a quick summary of patient info, color-coded allocation, EVS completion, and bed readiness. The highlight of this application is that the status can be updated in real time so that no time is wasted to move patients into their appropriate units. The messaging capabilities would not only be for charge RNs and bed control staff, but it can also be utilized to continuously communicate with their nursing team. A mobile-based bed management system that can be updated in real time would reap great benefits hospital-wide. There would be increased productivity and efficiency, improved patient transfer and care coordination, better predictive planning, shorter bed turnover and waiting time for patients in ED and OR, better and safer bed assignment, and most importantly, improved patient satisfaction. In 2020, a study was conducted in a university hospital in Malaysia to measure the feasibility of a mobile application for managing beds. The main goal of the experiment was to gather feedback from the 150 super users regarding its usability and its usefulness. A Likert scale from 1 to 5 was utilized, as well as open-ended questions about the positive and negative aspects of the mobile app were also asked. On average, the users scored the usefulness at 3.45, ease of use 3.40, and a satisfaction score of 3.42. A timelier bed turnover process with the help of a mobile-based management system via iPad or iPhone can reduce delays and expedite access to the right level of care. Patients can then reach their destinations faster, such as their assigned inpatient rooms or procedural and diagnostic units. All forms of communication clinicians should already have processes in place to maintain security and integrity of PHI. Frequent and randomized security audits will locate system vulnerabilities and violations. While the Joint Commission does not have specific HIPAA regulations, their standards do require compliance with applicable law and regulation. A digitalized driven hospital would provide accessibility of real-time data. It would facilitate predictive planning and improve operations. In order to do this, the electronic health record would be extracted of data elements. The EHR would then be reviewed by bed management to pre-plan. Meanwhile, unit charge nurses can easily access the record to ensure appropriate bed assignment based on patient acuity. The digital healthcare revolution is unstoppable, and the opportunities to transform the healthcare system are endless. Mobilizing the bed management communication system is a great start. Adapting this application that is designed to improve efficiency and expand hospital capacity would be a great addition to the patient flow process. I hope you guys enjoyed the video, and thanks for watching.